Let me start with a warning. This conversation might make you uncomfortable because we are going to talk about sex.
You can't get an erection or you struggle to get an erection. It's highly likely that you have a cardiovascular, metabolic, or diabetic problem. And here's why.
Your sexual health is not separate from your health. It's often one of the earliest signals your body gives you that something deeper might be going wrong.
We know the men who have sex regularly decrease their men who have sex once a week, cut their risk of prostate cancer by 50%.
And sometimes the first place they show signs of stress is in the one area people are least willing to talk about.
We talk a lot about life-work balance, but there's life-work-sex balance. People need to think about that.
My guest today is Dr. Elliot Justin, who has spent years on the front line of emergency medicine, seeing what happens when the body is ignored for too long. He is an emergency physician, entrepreneur, and someone exploring one of the most misunderstood and most avoided areas of human health.
Men don't think that way about rings, getting back to the pride issue. Next week, I'll be at the American Urology Association convention in Washington, D.C., and I'll be able to tell the difference between a gay doctor and a straight doctor. One question: do you use an erection ring? The gay doctor will roll his eyes at me like, are you an idiot? Of course I do. You got a better one. And the straight doctor will say, I don't need that. I'm good. Well, it's not about needs, but want. You want to optimize your performance. And this is a mindset changer for men and for the healthcare providers.
So, talking about the ring, what does your product show someone that they wouldn't otherwise know? And why does that matter?
And a man who's not worried about losing his erection is in a very different mindset.
And as it relates to problem of erectile dysfunction, I think most people don't like to talk about it. They ignore it. So what's going on psychologically there? Why people don't talk about it?
Well, I think it's pride. I mean, I think men find it very difficult to admit that they have a problem.
I've heard people describe it as a plumbing issue, and we also talked about it briefly, but I assume it's more complex than that. So where does it usually start to break down first, and why? Or let me put it this way. If the body was a system, is this more like a wiring problem, a blood flow problem, or a signal problem?
We've sold over 30,000 rings because we have a non-tech version of the ring. We've had zero complications. It's completely safe.
And who's this most useful for? And who might not need it?
18% of our customers they're recommended to get a ring by a doctor now, which is rewarding. And that number will probably, go up.
Elliot, welcome to Drug Diaries. Let me start with a warning. This conversation might make you uncomfortable because we are going to talk about sex, about erections, about erectile dysfunction, about parts of the body and experiences most people avoid discussing openly, especially in a serious medical context. And if that already makes you want to skip this episode, that's exactly why you should stay. Because that discomfort, it's not random, it's learned, it's cultural, and in many cases it's dangerous. We've been taught to separate sexual health from overall health, to treat it as something private, awkward, trivial. But here's the reality. Your sexual health is not separate from your health. It's often one of the earliest signals your body gives you that something deeper might be going wrong. Your cardiovascular system, your nervous system, your hormonal balance, they don't operate in isolation. And sometimes the first place they show signs of stress is in the one area people are least willing to talk about. So today, instead of avoiding this topic, we are going straight into it. Not to be provocative, but to be honest. Because if this conversation challenges your assumptions or makes you see your body differently, that discomfort might be doing its job. And before we begin, a quick note. This episode is sponsored by FirmTech, a company working at the forefront of sexual health innovation. And what makes this partnership meaningful to me is this. All proceeds from this sponsorship will go to Childhood Cancer International, a cause I care deeply about. So this isn't just about starting an important conversation. It's about contributing to something that genuinely matters. Now, my guest today is Dr. Elliot Justin, who has spent years on the front line of emergency medicine, seeing what happens when the body is ignored for too long. But instead of staying in the system that reacts to problems, he chose to focus on understanding the signals that appear much earlier. He is an emergency physician, an entrepreneur, and someone exploring one of the most misunderstood and most avoided areas of human health. Because what he's working on isn't just about performance. It's about awareness, early detection, and giving people visibility into something they've been taught to ignore. So in this conversation, we are going to break down what's actually happening in your body, what causes things to change, what most people get wrong, and what these signals might be telling you about your long-term health. This is a conversation many people won't have but one of the most important conversation everyone needs. This is Drug Diaries, and today I am joined by Dr. Elliot Justin. Elliot,
Great.
welcome to Drug Diaries.
Thank you. It's great to be here.
Thank you, Elliot. I was reading recently that many serious health conditions don't start suddenly. They build quietly for years. So what are people, especially men, experiencing right now that they are choosing to ignore?
Well, that's a great way to start the conversation, because I got into this because I was unaware of something that men are aware of that is of significance. So I'm a background, I'm an emergency medicine physician, and short of a heart attack or a stroke, there are a few emergencies that concern a man as much as a consistently limp, unperforming penis, to be blunt. And a matter of fact, if a man probably is consistently failing, he probably should have his driver's license taken away from him, because our mental health revolves so much around our sexual health. In the course of my career in medicine, I moved from emergency medicine into telehealth, and that got me interested in remote patient management technologies. What information can people get at home from wearables that will hopefully prevent them from having to see doctors? If they do see a doctor, they'll be more knowledgeable about when they should see a doctor. I mean, this device that we all have is smarter than all doctors for probably 99% plus of the problems in the world. So about 4 years ago, I was working with a physician at the University of Utah on a project on a sensor to regulate blood pressure after stroke. This surgeon was aware that I previously done some work on sexuality. I called it Project O. I was interested in neuromodulating human sexuality. People are familiar with cardiac pacemaking, planting electrode in the heart and controlling the heartbeat to make the heart beat after someone's dead. Imagine having that control over human sexuality when erectile dysfunctions and poor sexual health is so rampant. I succeeded in doing it in 2 rams, 2 male sheep, and then proceeded to have a urology surgeon friend of mine try it out on myself. We implanted electrodes by my pudendal and cavernous nerve, the 2 nerves are responsible for arousal and climax. Like every people's favorite fun nerves that no one's ever heard about. We tried all different amplitudes and frequencies of voltages, and I felt nothing but a tingling from electricity. And I actually don't think we understand the neurophysiology of human sexuality. But this surgeon had a friend who's a urologist and told him about this. And this urologist contacted me and said he wanted to count the number of nocturnal erections. Getting back to your question about early signals, nocturnal erections. Well, we all know about morning wood, as we call it in the United States, and we laugh about it, but we don't understand the significance of just having one erection in the morning is not an indicator of our sexual or cardiovascular health. So this urologist told me that nocturnal erections are a leading indicator of a man's cardiovascular and sexual health. And that took me aback. 1, because, hey, I'm a proud guy. I like to think I know a lot of things. I never heard of that before. And 2, leading indicators. We don't have a lot of leading indicators in medicine. In medicine, we treat associations and often overtreat them and harm people. So when it comes to high blood pressure, for example, my blood pressure goes from 120 to 140. It's not telling me I'm going to have a stroke or a heart attack, but my doctor's going to want to put me in a pill, and then is the pill really helping me? Now, if my blood pressure goes to 180 or 200, then I got a severe problem. But in medicine, we often tend to overtreat things in this sort of gray area with slight changes. We all follow lipoproteins today if we see a doctor. Well, if my cholesterol goes from, I'll make it up, 160 to 240, it's not predicting that I'm going to have atherosclerosis. It's just saying, hey, there might be something going on here. If the number of nocturnal erections that a man has comes down by 50% consistently, I don't know, because you're drunk. If it comes down by 50%, you have a close to 50% chance of having a cardiovascular problem in the next 2 to 3 years. Angina, heart attack, stroke. The majority of men who have heart attacks report increasing ED over the 3 months preceding the heart attack. And the vast majority of men who have strokes, it's like 88%, also report increasing erectile dysfunction over 3 months before they have a stroke. So to measure nocturnal erections would be a new vital sign. And a vital sign would be a lot more interesting to men than some fluctuation in their pulse or their blood pressure. So that's how I got involved in this. We live in this incredible age of healthcare wearables, smart watches, smart rings, smart everything, and there's this gap, and the gap is in sex. It actually is kind of shocking given how concerned our culture is with sex. Also, given the importance of sex as an indicator of our cardiovascular health and our mental health, that no one has come up with a wearable until us that will actually tell men in a predictive manner, a preventive manner. He indicated, what's really going on with them. So I like, analogy would be we're all on the road from erectile fitness to erectile dysfunction. Women too. Women have nocturnal erections as well too. And we all, of course, want to maintain our fitness. We're a very fitness-oriented culture, but we don't know where we are on this road because we don't have a dashboard. I mean, if I was going to drive to visit you, I would put tape over my dashboard and say, yeah, I'm just going to go for a drive and expect everything to work out well. So it's not surprising that crashes and breakdowns occur because we don't have data. And with data, we can say, here I am. I'm healthy. I'll pick on myself. I'm 73 years old. I average 4 nocturnal erections per night. They're over 35 minutes in duration. They're over 6 in firmness on 1-10 scale. I'm healthy. Not only am I sexually healthy, but that is a reflection of my cardiovascular health. So if you have data, tells us where we are on this road. It can help us to prevent problems because we can get signals before they become much more hard to treat or too late to treat. Ideally, of course, if we have a problem, we now have a way of objectively saying, this is how bad the problem is. And if we're going to propose interventions, we can say, okay, well, how is this pill working for me? Is that diet working for me? Is this exercise regimen working for me? Because ideally, if we're on this road with the fitness dysfunction, we got a problem. We want to make a U-turn. We want to back up, or at least stop going further down that road. It's our hope that I sound confident that what we're doing at FirmTech will become a standard of care in the assessment of all men, all women, certainly all men, all women over the age of 45 in the future. I mean, Kaushik, I don't know how old you are, but if you look, I'm not going to, you can tell me if you want. How old are you?
I'm 48.
I was going to say 45. You look young for 48. You don't look a day over 45. But if you were to go, if a man your age were to go to a doctor for a preventive health physical, for example, and they just looked at you and said, hey, you look good, come back next year, you would think, maybe you want to get an electrocardiogram, check my blood pressure, check my liver proteins. We would expect health care to be objective and data-driven today. But when it comes to sexual health, it isn't. And in terms of early signals, the 2 organs in the body that are most sensitive to narrowing the arteries, to arteriolosclerosis or atherosclerosis, are the retina and the penis. Okay. And getting your retinogram is not easy. You got to see an ophthalmologist. What the opticians do is not a really high-end, retinogram. And people are working on retinograms you can get off your phone, but they're not that accurate yet. But a man, in the privacy of his own home, can now use a safe, comfortable wearable tech ring to assess his sexual and cardiovascular health and see where he stands.
Right. And as it relates to the problem of erectile dysfunction, I think most people don't like to talk about it, or they ignore it. So what's going on psychologically there? Why people don't talk about it?
Well, I think it's pride. I mean, I think men find it very difficult to admit that they have a problem. Women less so. Men find it very difficult to have a problem, especially when this is something that's so key to their self-esteem. In addition to which, we're one of the least inhibited cultures in the world, but we are still too inhibited to talk about sex. We don't raise the issue with our doctors. Instead, we go online and get pills because that's what we've been indoctrinated to by pharma. And also, the doctors don't ask any questions about sexual health. I've never been asked about my sexual health by a doctor. My wife has never been asked about sexual health by a gynecologist without prompting it. The largest electronic health record system in the United States is called Epic. It's probably used in more than half the hospitals in the country. There are no questions about sexual health. So and people want to say, well, it's because doctors are too inhibited. We talk about shit, piss, vomit, diarrhea. Also, we talk about all sorts of disgusting things because those questions are in the electronic health record. If someone comes in and tells me that they have severe abdominal pain, I'm going to ask them questions about, well, you're vomiting, you have diarrhea, is there blood in your stool, et cetera, et cetera. So one of the problems is doctors don't make money by asking questions, which is a whole other problem with healthcare, which is we get the healthcare that can be billed for, not necessarily the healthcare that we need. Given how important sexual health is to our mental and overall health, and given that also gives doctors an important signal about someone's cardiovascular health, we doctors should be asking that question, but there's no box to check. And if there's no box to check, we don't ask the questions because there's no money to be made. And that's a tragedy.
Very well said.
Men are ashamed. So there's a Dr. Mohit Khera at Baylor University. He is certainly in the United States one of the 2 or 3 most famous urologists, andrologists, men's health doctors, world-renowned. And he recently said in a podcast, Viagra is Vicodin. And what do guys do? Viagra is Vicodin. Vicodin is a narcotic pain pill. And what did he mean by that? Well, he meant that what men do when they have a problem, and by the way, most men, I want to say what the problem is. Men have a problem, they go online. And they look for Viagra or Cialis or one of the other erection pills, or they go to the doctor to get it. And the doctors don't ask any questions. They just write the prescription because they press a button in the electronic health record. But what he means is that a lot of men, but not the majority, but a lot of men who have erectile dysfunction actually have an underlying cardiovascular, diabetic, or metabolic urologic problem, and they should see a doctor and get that assessed before taking a pill, because taking a pill could mask the problem becoming more obvious for a year, 2 or 3 years, and that could be dangerous. And Dr. Care also endorses the use of our device for 2 reasons, because it gives men and their providers potentially life-saving data. And also, our devices also address the most common cause of erectile dysfunction. But most men don't actually have erectile dysfunction. That's the big discovery that's been made with the data from using our device. So previous discussions about the diagnosis of erectile dysfunction it's tremendously overdiagnosed. One, because doctors there are billing codes for erectile dysfunction or hypogonadism. Your hormones are inadequate. So doctors want to check those boxes whether you really have those problems or not, because then they get paid for seeing you. That's just the way it is. Here's a definition of erectile dysfunction, and this is where the fundamental mistake occurred, really back in the late 1990s. And the mistake flows from the fact that 2 things. One, the academic doctors who set standards in medicine, they see the sickest people in their practice, and they project them on the general population. We've seen that with hypertension. We've seen it with low proteins. So here's the definition of erectile dysfunction. This is the official definition, I'll paraphrase, by the International Society for Sexual Medicine. First clause, inability to get an erection or difficulty getting an erection. These are the men, largely, who are being seen by these doctors in their academic practices. And these men have a real problem. Assuming that your problem is not due to drugs or alcohol, if you consistently, especially if a man's alone and masturbating, if you can't get an erection or you struggle to get an erection, it's highly likely that you have a cardiovascular, metabolic, or diabetic problem. And here's why. Because the heart is pumping blood to the penis through the arteries. If the pump is not working well, it's about plumbing. The pump isn't working well, you have angina, heart attack, myocarditis, other cardiac problems. You're not getting enough blood to the penis, so you're going to struggle to get an erection. Then, often in combination, you have the pipes that come out of the heart, which are the arteries, and they get narrow from diabetes, hypertension, atherosclerosis. Often these two, often the pump problem and the artery problem are in combination. And the end result is men can't get an erection, they struggle to get an erection. And if any man is listening to this show and has that problem, you need to see a doctor. Otherwise, you're ignoring potentially life-threatening, sort of life-changing medical problem. And then in the 1990s, along came Pfizer's application for Viagra. And Viagra is we call them PD5 medications. Let's call it an erection pill for the sake of this conversation, rather than talking about a brand. It's called drug is called sildenafil, and it will put a little more blood in the penis. So it helps men who aren't getting enough blood in. But it doesn't always help them a lot. If you go back to the original Pfizer application to the FDA for Viagra, sildenafil, as I recall, I think there were about 7 papers. And 2 of the papers showed no more benefit than the placebo.
Really?
Think about that. The paper that showed the largest benefit was in men who have had prostate surgery. Well, that's not most men. It's a subset. And the other 3 or 4 papers showed benefit in the 35 to 40% range using this objective scoring system. Not an objective, hey, we're measuring blood flow, but it's men saying that they got better. Well, most people are familiar with the placebo effect. And the placebo effect is about 25 to 30% benefit. Just for men to be taking something that they think is going to do something. The Hawthorne effect, which is more powerful than the placebo effect, people have confused it with the placebo effect. The Hawthorne effect is different. The Hawthorne effect says, hey, Kashik and Elliot, we're conducting a trial of a pill that might improve your sexual health. You're either going to get a placebo, sugar pill, or the real pill. Well, the Hawthorne effect is when you anticipate something might actually have a benefit. That actually heightens placebo effect. So I certainly think that the pills for sexual dysfunction in men are valuable, but they're not game changers. Don't take a pill and get an erection. So that's the first clause. Inability to get an erection, or difficulty getting an erection. That, to my mind, is real organ dysfunction. That's an organ that's not working. But that's not true for the vast majority of men. The vast majority of men get an erection and they lose it. The second clause says difficulty maintaining an erection. Now, that could be from lots of causes. It could be there's a baby crying next room. You're worried about paying the mortgage. You and your wife haven't been getting along. And with your children, problem at work. There are all these psychological issues that can have an impact. It could be that you're taking some medications that we doctors prescribe that can make it harder for you to sustain an erection. The antidepressants, the SSRI antidepressants are erection killers. I don't think they should be prescribed at all. That whole class of medications never been tested for the long-term effects, and they're clearly obviously hard for people to get off of. And there are quite a few of the antihypertensives that we prescribe also impacts sexual performance, as do the flow medicines for prostate problems. And there's alcohol. Always, there's always alcohol. But the man is getting an erection and then losing it. We do need to look at the larger causes of this, but the immediate physiological phenomenon is that blood is leaving the penis, and therapy should be directed at keeping blood in the penis, and only an erection ring would do that. And I didn't understand this 4 years ago. Yeah, take a pill, pull more blood in, but you want to keep the blood in. Pills don't keep the blood in. And if you told me 4 years ago, Kaushik, that, hey, Dr. Justin, you're going to be talking about the benefit of erection rings for the rest of your medical career, I would have said, no way. I would have said, like most doctors, straight doctors, why? I know I'm good. I don't need that. But now I understand it's not about being good. It's about being great. And any man, whether you have ED or don't have ED, you want to optimize your performance. Put a ring on it, take a pill. Put more blood in, hold the blood in. But here's what the data set shows. So we documented, I don't know, like 240,000 erections right now on close to 5,000 men. I have world-renowned urologists as my advisors. And their expectation, as was mine, was that as men report more erectile dysfunction, the number of nocturnal erections will come down, the firm's nocturnal erections will come down, and as we get older, the firm's sex erections will come down. And that didn't happen. And I remember when we had like 40,000 erections, maybe a year and a half, 2 years ago, looking at the data thinking, there's something going on here. We're not seeing what we thought we would see. Why are men reporting more erectile dysfunction? But the guys, until late 60s, early 70s, men are staying just as hard and having just as many nocturnal erections as men in their 30s. That shouldn't be happening because we have this, pandemic of nocturnal erectile dysfunction. It's 50% by age 50. By my age, it's 10% per decade. Afterwards, my age, it's 70%. Your age is 40%. Why are men saying they have ED when they don't? And when I say they don't, I mean that if you're having erections at night, you don't have ED. There might be psychological issue, some other issue. And then it occurred to me that the problem must be on the other side of the circulation, the venous side of the circulation. Blood is leaving the penis. And actually, this is something that's normal in all men as we get older. And what we've done in medicine is we've medicalized part of the normal aging process. And to your point earlier, we've created profound shame about this. As opposed to, hey, I'm getting older, it becomes, I got erectile dysfunction. It's embarrassing. It's shameful. It's a failure. Kaushik, I'll pick on you for a second. But do you run as fast now as you did when you were 20? No, do I. You got a problem. And the problem for the vast majority of men, yes, you should lose weight. Yes, your diet is terrible. Yes, your life is too sedentary. Yes, you shouldn't have had that fourth cocktail. Yes, you're at age 65, you can't dance till 3 o'clock in the morning and perform in bed. All these things are issues. But if you're getting hard and you're losing it, the answer is put a ring on it, take a pill. And we have research papers that validate that. And this is a game changer for all men.
Right. And Elliot, you spent years in emergency medicine, which is where people end up when something has already gone wrong. So what patterns did you start noticing in patients you were seeing?
Well, I started practicing medicine around the time when you were born. I went to medical school in the mid-1970s. I think over the years I saw progressive deterioration in people's quality of health, and that people got more obese. Their lifestyles became more sedentary. So the divorce rate increased. I also saw that some of the medications that we were give people actually weren't that harmful. I certainly saw a lot of over-testing going on. That all that said, I really enjoyed medicine. I'm probably just tangentially. I probably took care of about 175. I probably had about 175 to 8,000 patient contacts with people. I have to say, most people I used to get to see people at their best and their worst. Early on in my career, to generalize, people were more stoic. Towards the end of my career, people were angrier and more demanding, often in ways that that weren't realistic. But I have to say that but on the other hand, there were improvements. We saw less people in the ER with cancer because cancer was being better taken care of by specialists.
Yeah.
Saw less. It's going to contradict what most people think. Right? I saw less gun trauma, less motor vehicle deaths. I think that the culture became something more safety conscious, overall, to its benefit.
And most people wouldn't choose to work in a space like sexual health. It's uncomfortable, misunderstood. Why did you choose to lean into this instead of avoiding it?
I think that, well, for one thing, I think that sex is a keystone of happiness. Certainly a keystone of successful marriage. I think a successful marriage, and I've been married for 38 years, rests upon three things. One is shared values. Two is a shared project, a long-term project. And that can be a business, but it's usually children, maybe children and a house, family. But three, upon sex. It's just well established by data that the benefits of sex are enormous. I'll just mention some of them. Men and women who have sex every day, masturbating with the partner, have cortisol levels that are 30 to 50% lower than people who don't have sex every day. Well, that's a stress hormone. So people think there are all these things that people go through to try to reduce their stress levels: meditation, exercise, diet, etc. But if you're in a partnership, you can create that intimacy and that benefit every day with your partner. And what better way is there to spend 30 to 45 minutes than making love with someone that you love? So there's that benefit. We know that in long-term studies of men who over the age 60 or 70 who have sex 3 times a week versus men who have sex less than 3 times a month, those men who have more sex more frequently cut their risk of a major cardiovascular event up to 50%. We know the men who have sex regularly decrease their sex once a week, cut their risk of prostate cancer by 50%. And then there are the benefits to your mental health, but also the benefits to your children. We all know, yes, people can't successfully single parent, but we know it's hard. And we know that the children of single parents are less likely to finish high school, finish college, make more money than their parents, but they're more likely to commit gun violence. They're more likely to get involved with drugs or alcohol. And we know that couples that have sex 3 times a week versus couples that have sex less than 3 times a month have half the divorce rate or half the separation rate in their partnership. I mean, if we had a responsible healthcare system, it'd be the doctors and the government would be telling people like you and me and everyone, you need to have sex more. How often are you having sex, Kaushik? You need to, in order to contain Medicare and Medicaid costs, you need to be doing your social duty and have more sex. And I know it sounds funny, but that's the benefits are really significant. You just you asked me earlier about what change did I see? Well, there's kind of some alarming changes. People are having less sex, and they're leading lonelier lives as a consequence. We also see this dramatic decline in men. Well, not in women. We don't understand why it's not in women. We see this dramatic decline in testosterone levels up to almost 40% over the last 40 years in men, and that has a negative impact upon men's health as well too. So,
Yeah.
That's what
sex
is always interested me, and this for me is a legacy. I mean, I've had other successful businesses, and I was a pioneer in telehealth, and I was a pioneer in emergency medicine, involved with automatic external defibrillators and specialized airway management by paramedics and EMTs in the field. But what I'm doing now is a much greater legacy, because we are taking, because we're coming out with a female device as well too this year. We are taking urology and gynecology into the 21st century of a data-driven, personalized care. Personalized meaning we're not treating people as, hey, it's one size fits all, everyone gets the same thing for a problem, but rather, here's your data, and we're going to use your data to come up with a treatment plan that's going to benefit you. And that's revolutionary. I'm confident, as I said earlier, that what we're doing will become part of the standard of care for assessing men and women's sexual and cardiovascular health, because it's yet another tool to get data. The biohackers talk a lot about hacking health, but you can't really hack health unless you track it. The biohackers, and I admire what they're doing, many of them, they have theories about diet, peptides, supplements, etc., that can increase our lifespan. And I like to talk not just about a lifespan, health span, that is. I talk about, hey, but what about the sex span? We talk a lot about life-work balance, but there's life-work-sex balance. People need to think about that. But you can't really hack something unless you can track it. You do need data. And as much as I admire what Brian Johnson is doing, if you can take 180 supplements, you don't really know which ones are helping you. And there may only be 5 of them, 6 of them. But you need to isolate these things and study them, these variables in isolation. And we've studied 13 supplements and peptides here. I can tell you, but almost nothing works. But you need data to do that. Otherwise, you're just hazarding a guess. And it's a thesis. Every thesis needs an antithesis to test it before you can say, well, this is an hypothesis. This is now proven.
Yeah. And I remember a friend once said to me that if it's not affecting my day-to-day life, I'll deal with it later. So what's the cost of that mindset when it comes to this area of health?
Well, look, I could be sitting here, I could be weighing 300 pounds and still be doing the work that I'm doing, but I got a problem. I could be sitting here with one nocturnal erection, still be able to perform sexually, but I'm on my way to having a heart attack. So I've heard that too from people. And we need to think more. We owe it to ourselves and to the people that we love and we're involved with to take a more balanced, long-term view of our potential, how our pride and our laziness and our inertia can be trapping us, preventing us from addressing problems before they become really big problems.
And like you said earlier, there's also ego involved. People don't want to confront certain realities. And when someone notices something isn't right, what do they tell themselves to avoid dealing with it?
It'll pass. I'll go online later on, look for an answer. The solution to most problems, and I'll put inertia and depression in that category, is action. Get on with it. Do something. Someone just told me a story the other day about how Winston Churchill was prone to what he called black dog, depression, and he would his one of his solutions when he had black dog, this is when he was out of office in the 30s, was to lay bricks, and he would try to lay 200 or 300 bricks a day when he was depressed, just because that meant there was time when he wasn't. Hey, you're doing something. I at one point I had a sign on my desk that said, "Get on with it." Just, my perspective, that's a better way to live, but it's hard for people because change often means they have to do something or give up something. Or now getting back to the point about sex, talk about it. And often the three. I mean, I've now spoken to, in the course of what I'm doing, 180 men over like the last 2 years about their sexual health. Not a lot, not a huge number, but it's a significant number. And we talk a lot about the importance of communication in marriages or partnerships. But there are things actually that men don't want to talk about with their partners because they're afraid it'll turn their partners off. They need to talk about them because they're not going to get any better unless they talk about them. And then there are the same thing. I'm certain applies to women as well too. Talk is a start, but action is more important. I think the one mistake that people make when it comes to their sexual health, their marriages or their partnerships, is they don't plan for pleasure. They rely upon spontaneity. Well, it's not the way things work in life. Kashika, so I think I told you earlier, I'm a really good cook. And my wife brags about how the best restaurant in Bozeman is at my house. Well, if you're going to come to visit me, I wouldn't wait till the doorbell rings to think, oh my God, Kashika's here. What's in the refrigerator? Oh, I got some leftover rotisserie chicken and some mayonnaise. No, I would plan a meal. If I'm going to take a trip, there might be some spontaneity in terms of I'm in Stockholm. I'll just leave it open. What I'm going to do that day, I'll figure it out then. But I plan the trip. I'm just drive to the airport. Think, where should I go today? You don't get anywhere without planning. But somehow or other, when people have sexual problems in their partnerships, they say, well, we've lost our spontaneity. Plan to get out of it. I don't go to I go to the gym 3 times a week and I work out with a trainer. I don't go to the gym and just what am I going to do today? I have a plan because my goal is fitness. So I think what comes to, and sex, frankly, is so much fun. It's so pleasurable. The fact that people won't plan kind of takes me aback. Here in Bozeman, this is a very fit town. People in my gym know what I do, so they'll talk to me about their problems. These are young people, they're in their 30s and 40s. They're not having sex with their partners. And my response is, quite often is, you're in the gym 10 hours a week. Why don't you just take 2 hours of that out away and dedicate that to improving your relationship? And they look at me like, what are you talking about? Well, it's not going to happen unless you do it. It's not, you're not going to go home and see your wife or your husband today, and it's going to be like it was 20 years ago. You need to get out of that rut. I really emphasize planning for pleasure because that's the way it is in all of our lives. Right? In all areas of our life that are pleasurable. We plan to go to that restaurant. We don't just randomly, I'm going to just walk into a place. We plan meals. We plan trips. We plan in our businesses. And some or other, you think that you're going to improve your marriage or your partnership, the lovemaking aspect of it, spontaneously. Kind of weird, isn't it?
Yeah. So, I've heard people describe it as a plumbing issue, and we also talked about it briefly. But I assume it's more complex than that. So, where does it usually start to break down first, and why? Or let me put it this way: if the body was a system, is this more like a wiring problem, a blood flow problem, or a signal problem?
Well, I would break this first down to 2 large categories. We've got men whose primary problem is cardiovascular, urologic, or diabetic. That's one group. The vast majority of men, that's not the case. And it's a combination in those men of two things. One, all men lose erections faster as they get older. That's part of the natural process of aging. We shouldn't call this dysfunction. So what's going, and of course it's aggravated by obesity and poor health and poor exercise habits. All men's erections go down faster. So what's going on? Blood is, I'll draw an analogy to other body parts. If I fly to visit my grandchildren in Sweden, and I'm spending all day on a plane, 14, 15, 16 hours sometimes on a plane, my socks get tied and my rings get tied. It didn't happen when I was 25 years old or 30 years old. And why is that? Well, as we get older, the smooth muscle, and we can't work out a smooth muscle in the gym, so we can't control it. The smooth muscle around our small veins, our venules, gets weaker, and these muscles get weaker and stiffer. And by the way, that's why it's important to have sex, because you got to maintain the tone in those muscles. And only having sex will maintain the tone in those muscles. You can't do it in the gym, at least not the gym I go to. And then the venules, the small veins, they get stiffer with age from calcium. And the end result in your fingers and your ankles as you get older is we don't pump blood back to our heart as easily. So we leak a little bit of blood out from the blood vessels into our ankles or our fingers. So rings and socks get tied. In the penis, it means the blood's leaving the penis faster. When you're a guy and you're 15 years old, or some girl holds your hand for 5 minutes, you get an erection for an hour and a half. It doesn't happen when you're 25 or 35 or 40 years old. We don't hold blood in our penis as long. Now, part of it as well is that it's also, now we have physiological problem. Let's call it venous leak. Blood is leaving the penis faster. Then we have mental issue. And the mental issue is, well, as you get older, you have a lot more in your mind. When you're 20 years old, I'm talking about men now, you're probably sex with a goat. When you're 20 years old, you're not thinking as much. You don't have a job. You're not worried about, you don't have any debts. You don't have a job. You don't have a boss. You don't have a partner. You don't have children. You're not working. Your life is actually so much less stressful. Assume you're an average kid in college or whatever. So much less stressful. And as you get older, you have all these other things on your mind. And also, the longer you're in a relationship with someone else, the more things that might irritate you about that person. So there's a lot that can go wrong mentally. And meanwhile, blood is leaving your penis faster because you're getting older. And these two factors play off each other. So what comes first, the blood leaving the penis fat issue or the confidence, anxiety component? But the two of them play off each other. And once a man has persuaded himself that he can't or is unlikely to perform, that's a killer as well too. So how do we fix that? Well, we can address the blood leaving the penis faster issue with an erection ring. And this I didn't understand 4 years ago. But I certainly, as a man, have experienced the impact of all the things I mentioned before: alcohol, irritation with my wife, these something that gets said, or having been worried about business, something that all these things can make the chance of success less. And the ring is a profound way of addressing this. So I'll bring up. I'm going to mention right now. I don't want to get too graphic. So I'll mention one common complaint that men have about women in an established relationship, not when they just date and meeting someone or early on, but men have about women that men don't want to talk about with their partners. Yeah, I'll focus on one of them. Women, many women, not all, but many women, even when they're really turned on in a committed relationship, will start talking about something else in the middle of sex. Something that, this happened with the kids. My wife, just a few nights ago, was just a better idea for redesigning our bedroom. Now, as a man, these things would irritate me because I'm we get aroused and we want to have sex. So about 2.5 years ago when I came up with the form of the ring, my wife and I were making love. I live in Montana. It's February. It's cold. It's snowing outside. And my wife says, "No sex." Oh, I think I left the garage door open. There's probably not a marriage or a committed relationship in the whole world where the woman then jumps out of bed, gets dressed, closes the garage door, comes back upstairs, and wants to resume having sex. That's just not the way it works. It's the man's got to do this. I go downstairs, and not as the garage door open, and it's snowing, but the rear door of her car is open. She'd probably been bringing in groceries and forgot to close the doors. Well, as I'm coming back up the stairs, my wife calls out to me, "Hey, Elliot, that tequila I like? Can you put some on ice? Oh, and don't forget the lime." Now, I'm a guy. Narrowly for me, without the ring, this would have been a WTF moment. It would have been, "We're not having sex tonight. I'm angry. How can you do this again, blah, 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 blah." But I come upstairs and I have the ring on and I still have an erection. And a man who's not worried about losing his erection is in a very different mindset. My wife points at tequila and says, "Elliot, the garage door was the truth, but the tequila was a test." And, so there's something that a common friction point between my wife and I, and I've heard about this from customers and patients as well too, and the ring fixes it. Because I'm not worried. You want to start talking about something that we're not happen with the kids just for a few minutes? I don't care. Because once I'm aroused and have the ring on, I'm good for 45, 50 minutes with minimal stimulation. So I hope that was too graphic for you, for your audience.
No,
it's an example of how of the power of the ring to produce confidence between two people. So there are things,
right.
And then also there's a tendency, which I learned talking to men, that if you're worried about losing your erection, the men will want to come quickly, which isn't particularly satisfying, frankly, to either partner. But with a ring on, you're not worried about losing your erection. So here's what the ring can do. And I'd be like, I got into this as the data, and the data is potentially life-saving, life-changing in terms of someone's cardiovascular, sexual health, medications they take, changing their habits, losing weight, drinking less alcohol. But the ring itself will help men to last longer, be more confident, and have a more intense orgasm. How? Why? Because again, I didn't understand this 4 years ago. Because a well-designed ring, and ours is the only one that has huge thousands of people. I mean, we've documented 240,000 erections as a man. We've sold over 30,000 rings because we have a non-tet version of the ring. We've had 0 complications. It's completely safe. But the rings were designed to put the right amount of pressure with the urethra to draw out the ejaculatory phase. Well, my ejaculatory phase goes from 4 seconds to 7 seconds, and that's an incredible orgasm. And I wouldn't have sex without a ring now. And my wife laughs that she's glad the kids are at the house because I'm noisy for the first time, which she likes. The ring itself. I mean, women have, in the course of my life, women have vibrators that become normalized. They weren't around in the 1960s or early 70s. And in the early 80s, they were regarded as dangerous. They'll be numbing. That's the end of the American family. And now they're normalized. It's hard to find a woman in the United States, or frankly, in most of the world today, even in the Gulf, I don't mean the Gulf of America, Trump's Gulf of America. I mean the Persian Gulf or the Arabian Gulf, whatever they're calling it today. The vibrators have become normalized for women. But men don't think that way about rings, getting back to the pride issue. Next week, I'll be at the American Urology Association convention in Washington, D.C., and I'll be able to tell the difference between a gay doctor and a straight doctor with one question. Do you use an erection ring? The gay doctor will roll his eyes at me like, are you an idiot? Of course I do. You got a better one. And the straight doctor will say, most of them, male pride, I don't need that. I'm good. Well, it's not about needs, but want. Do you want to optimize your performance? And this is a mindset changer for men and for the healthcare providers.
So talking about the ring, what does your product show someone that they wouldn't otherwise know? And why does that matter?
Well, you don't know how many nocturnal erections you're having because you're asleep. So a healthy man, your age, should have 4 to 5 nocturnal erections per night, 35 minutes duration, and a 6 in firmness on a 1 to 10 scale, based on our database of over 4,000 men, close to 5,000 men. Right now, I don't have to pick on you, I'm just joking because you're probably healthy.
Sure.
But right now, if you only have 2 nocturnal erections, you got a problem. You can still perform sexually. You wouldn't know that you have a problem, but you have a problem. And the goal of a wearable is to identify a problem before you have a problem. Now, that problem could be with your heart. That problem could be metabolic. It could be with urological, but you've got a problem.
Yeah.
And that's the power, the diagnostic aid power of the ring.
And I think people worry about complexity and whether something will disrupt their routine, their lifestyle. How does this fit into someone's daily life in a simple way?
Well, I think people use all men should use rings for sex, for the reasons I mentioned before. But in terms of the data, if you're healthy, and you're probably healthy, then you would get the ring and you'd establish a baseline. Just the way, hey, if you bought a blood pressure cuff, you not get one reading. You might, that's stupid though, because you actually want to see your blood pressure over several days. With the ring, you get 3 or 4 nocturnal readings. You get one maybe reading while masturbating, while having sex. Now you have a baseline, and it's probably gonna be normal in your case. So then you say, okay, I'm normal right now. I'll check this once a month. I'll check it every other month. If I have a problem, I'll then check it. But normal data is really, really valuable. I mean, I have had a couple men complain to me, hey, I bought your ring. It was $275 and I was normal. So you didn't help me. Well, if I go to a doctor with chest pain and the doctor says, hey, your electrocardiogram and your enzymes are normal, I don't think, well, why do I even bother coming here? Why do you even get these tests? So, normal data is really valuable because it establishes a baseline. But about 15%, 20% of the men who buy the ring have a problem, and the ring health signals a problem to them. I'll give you 2 extreme examples. We've had 3 men that were aware of cardiac catheterizations because their data was so poor. These are men. One guy was younger than you. We've had 2 men in their 20s, one who had real erectile dysfunction. They struggled to get it up or keep it up. One guy had an adrenal tumor, and the other guy was taking anabolic steroids. that were preventing intimate sexual performance. At the other extreme, we've had 4 men that we're aware of not get penile implants. They thought they had ED, but they had normal nocturnal erections. And their problem was not ED, their problem was psychological, a problem in their relationship. So the data is potentially life-saving and valuable.
And like you said, data is useful, but it's only useful if people understand it. So what does the app show? And how should someone interpret what they're seeing?
Well, we're in the Google and Apple stores. The app is easy to use. The Bluetooth is off when it's on your body. And we have educational YouTubes. We show people when they buy the device in the handout, and also in an email we send to them. We show them what normal and abnormal look like. And we also have notifications. So it could be, hey, Elliot, your erections, since you started taking medication X, your nocturnal erections have gone up by 20%. Or it could be, hey, Elliot, since there's a problem. Last month, your sex erections were 10, and this month, they're 7. It has a big change in your medications, habits, vices, et cetera. So we provide active notifications. In addition to which, there are now over 80 doctors in the United States they're getting the data. The patients can send the data directly to their doctors to go into their healthcare record.
And who's this most useful for? And who might not need it?
I'll start with sex. It's clear from the data that all men's sexual performance, even if you think it's really good, all men's sexual performance and pleasure will be improved by the use of a ring, because you will be harder, you'll last longer, and you'll have more intense orgasm. That's the way it is. As far as the data goes, I think all men know that 45, 50 who are interested in hacking in their health now we have a fresh way of tracking it as opposed to guessing what's going on. If a guy is 25 years old and he's dating using this tool, and he's seeing people who is not, and he says, gee, I got performance anxiety, I'm going to go online and get some pills. I don't have a problem with that. But if a man over 45, 50 is going online to get pills, you're making a mistake, because as Dr. Kara said, Viagra is Vicodin. You could be masking.
And this is something I would like to tell the audience, that if you're curious to explore this for yourself, there's a link in the show notes. FirmTech are offering 20% off with the code Drug Diaries. And I haven't tried it yet, but I'm curious to see what the data really looks like in practice. So coming back to you, Elliot, I always find real user stories more revealing than features. So what's something you've heard from users that stuck with you?
I guess what I wasn't expecting when I got involved with this as a urologist was the impact on men who've had prostate surgery, because the incidence of impotence after prostate surgery is huge. It's 40 to 60%. These men can often go a long time and just give up without sex, and they give up. Several things happen. Their penises atrophy. They don't find the therapies to be effective, and they're not patient. There's increased suicide. There's increased divorces. And I've had I'll just focus on one man. It was 20 months out from prostate surgery. His wife was going to leave him. He was very depressed. And he stopped using penis pumps. He stopped taking pills. He wasn't doing any exercise. He'd given up. A urologist mentioned our product to him. No, he actually heard about us from a prostate chat group. It wasn't not been on Reddit, but on social media. And he contacted me and said, "What can you do for me?" I said, "Well, you're out a long ways. 20 months is a long time. What I can do is tell you whether your situation is hopeless or not, because we can see whether you have nocturnal erections." And he used the device for 4 nights, and he had no nocturnal erections, but he did have one of those nights. He had a flicker of a waveform that looked like it might be an erection. And I said, "Why don't you try this? Take the pills again, start pumping again, and give it a month, and then let's test you a month from now." And a month later, on an overnight reading, he had a nocturnal erection that was at 3. It was very, very, very weak. And a week later, he had one nocturnal erection that was a 10. And he started having sex again. And he and his wife are now they're still together. And that was heartwarming. At the other extreme, there was a guy in his 20s who wanted to have children, but he was struggling to have sex regularly since his 20s. And the pill, he's a bodybuilder, professional bodybuilder. He was taking anabolic steroids. And the device made him realize, I am destroying my virility, if you will. I might look great, look really virile, but I'm destroying my ability to have sex or have children. And he stopped, gave up bodybuilding. He's still really fit. Gave up bodybuilding and stopped taking anabolic steroids. And he now has 2 children.
Wow, that's wonderful. And I think these are the experiences that makes everything worthwhile from your perspective. I think making a real difference and impact in people's lives, transforming people's lives. So I think that's That's really a profound experience you shared. And just talking about the practical aspects, do people have to keep the ring on all the time, or how does it?
No. Well, if you want to catch nocturnal erections, you have to wear it overnight. And sometimes the first night or two, it can be a little bit annoying. Why? Because we're men. Women wear things around their body all the time. You might notice that women pull in their bras, separate times a day. They're not even aware of it. They're adjusting it. So it's commonplace for about 25-30% of the men when they wear a ring for the first couple of nights. It pulls in the skin. You just got to unhook it and rehook it, then you get used to it. I'm unaware of it right now. And sometimes I get up in the morning, I go upstairs, get a cup of coffee. It's like, oh, I got the ring. So it's really easy to use.
And if someone, sorry,
but it doesn't need to be worn all the time, though. I mean, the only people I know wear all the time are gay guys, and that's for a whole other reason. They're getting more. They want to document any action they get during the day. I don't know any straight guys that do that, but it can be worn obviously to optimize sexual performance as well too.
And I'm just thinking, if someone wears the ring before an erection and they want to have sex, so wouldn't it stop the flow of blood?
No, because it's not made out of hard silicone. It's not one of these hard silicone O-rings that cut off the arterial circulation. These conventional erection rings are essentially lynching your penis. I mean, you got to have full erection, then you put this thing on it, it chokes it off. In order to count the nocturnal erections overnight, we have to make the ring out of a different material. The ring is made out of elastomer, so it allows the arterial blood to flow in. And elastomer is a much more comfortable material than silicone.
So another question I have is, behavior change is hard, and even when stakes are high. So what actually drives someone to take action in this area?
I wish I knew exactly, because I'd be a very rich man, because so many men would benefit from this who are not doing it. What drives looking at customer surveys of our men, they break down to two groups. One group are the biohackers. The average person who buys the tech ring has a master's degree or better. There are a lot of engineers, buying the device. The average person who buys a tech ring already owns a wearable. They've got a smartwatch, they got Whoop or an Apple Watch or a Garmin or something of that nature. So there's the people who want to optimize their health, and they want data about their health. They recognize intelligently that data is a key to optimizing one's personal health. And the other group, well, there are two more groups. Then there are young guys who've heard me on podcasts, and that they've heard that the ring can increase your ejaculatory phase. The ring can help you party harder and still party in bed. And I've experienced that myself. I would say I can drink more alcohol, stay up later, and not worried about my sexual performance. I know I'm still gonna be able to perform with the ring, which is fun. So that's the third group. So we have the hackers, the data hackers, the fun people, the fun group, but they're not buying the tech ring. They're buying the max performance ring or the performance ring. And then they're the men with problems. The men who 18% of our customers they're recommended to get a ring by a doctor now, which is rewarding. And that number will probably go up as doctors become more and more aware of what we're doing, and more and more doctors read the research papers that have been used, in which the research that used our technology. So they're men with prostate disease, they're men with SNP, they're men in that 12 to 30% group who have heart problems or diabetic problems.
Right. And if, let's say, some people will listen to this and still do nothing. So if someone ignores everything we've discussed, what's likely to happen over time?
You will get erectile dysfunction and your penis will atrophy if you really go without sex. And there's evidence, strong associative evidence that you will not live as long. If I had to give a mission statement, I'd say our goal at FirmTech is better sexual health and longer lives of lovemaking for everyone.
And Elliot, what's the uncomfortable truth people will hear today and still ignore?
Well, the uncomfortable truth is if you're struggling sexually, there's a significant chance that you have a significant problem, and you need to deal with it. The other part of it is the vast majority of men, if you've been identify yourself and labeled as having erectile dysfunction, you might not even have it. So this concern that you have, this diagnosis that you've made about yourself, others made about you, may not really be true. So you might be putting off sex. You might lack confidence over something that is just part of the normal process of it.
Yeah, or it could be just psychological or anxiety.
Well, that's like, yeah, exactly, yeah.
Yeah, absolutely. And now I think we are going to get into a very quick rapid fire round. And here I'm going to say a statement and just tell me if that's a myth or a reality, and give me the truth in 1 or 2 lines. So to begin with, erectile dysfunction is just a normal part of aging. Myth or reality?
Reality.
If everything seems fine, there's nothing to worry about. Myth or reality?
Myth.
Sexual health has nothing to do with heart health. Myth or reality?
Myth.
This is mostly a psychological issue. Myth or reality?
Myth.
If it happens occasionally, it's not worth paying attention to. Myth or reality?
Depends on the age. I'll go with myth. but it depends on the age.
Right. You'll know when something is seriously wrong. Myth or reality?
Myth.
Tracking this kind of data is unnecessary for most people. Myth or reality?
Myth.
Talking about this openly would actually improve people's health outcomes. Myth or reality?
Reality.
If you're fit and active, you don't need to think about this. Myth or reality?
Myth.
Most people listening to this are ignoring something they shouldn't. Myth or reality?
Reality.
Right. And that brings us to the end of our today's conversation, Elliot. And I think what really stood out to me from this conversation is how much the body tells us if we are willing to pay attention. A lot of what we talked about today sits in the uncomfortable space. But that's probably exactly why it matters. Elliot, thank you so much. This was genuinely eye-opening. I really appreciate your honesty, the way you've helped make something complex feel simple and practical with your amazing analogies. And if you're listening and this made you think even slightly differently about your own health, that's a good place to start. And remember, if you're curious to explore this yourself, there's a link in the show notes. FarmTech are offering 20% off with the code Drug Diaries. And thanks for being here. This is Drug Diaries, and I'm your host, Kaushik Trivedi. See you next time. Thank you,
so
Elliot.
much. Thank you.
Thank you.